Thank you, both Supervisor Chan and Mr. Kaplan, for that very interesting presentation. The human impact budget is my favorite part of the budgeting process. It's the most interesting part and the most common sense part to me. So now we are going to be joined by Dr. Muntu Davis. And Dr. Davis is currently the Public Health Department Director and County Health Officer for Alameda County. Previously, he worked in the immunization branch of the California Department of Health Services and practiced medicine in urban and rural primary care and urgent care clinics in Northern and Southern California. Dr. Davis received his medical degree from UCLA and his Master's of Public Health degree from the Harvard School of Public Health in Boston, where he analyzed policies regarding emergency response planning, implementation, evaluation, and modification at the county level in California. Dr. Davis is going to come up and present local data on the impact of poverty on children and their families in Alameda County.
Good morning, all. So if we have a room full of people and we're talking about a war on poverty, you guys must be committed. This is not something that everybody wakes up daily, except for us who are really looking at the data to say this is what we're going to work on. But it's actually one of the most important things I think we can look at. As a health officer and a physician, when we look at health, one of the biggest things that we see are things that are outside of our individual control as a health department. And the context in which people find themselves that is impacting their health is way beyond something that we directly control. Okay? So it takes everybody to really sort of look at that context. And if we're talking about a war, we always, when we think of wars, wars often involve beliefs and values. And so as I go through this, I want you to think about your own beliefs and values, the beliefs and values of your organization, and take a little bit of the context that I show regarding health. So when we look at some literature, we know that in terms of children, when we're talking about changing what we see in terms of health status, we can do a lot of that early in a child's life based on what we find the context for them. And so as we talk about this article in particular, when we look at local levels of stress that a child finds themselves in, the context in which they find themselves growing up in, those repeated levels of stress actually have an impact and set a trajectory for their health in life. Now, if we're talking about what happens with that, so over time, just imagine repeated stress, such as poverty and the impacts of poverty, the conditions that come with poverty. Over time, we see all of these different outcomes. Now, it's very strange that you don't necessarily think that these are necessarily direct, but over time, repeated, these are the things that we ultimately see. So we're talking about coronary artery disease, we're talking about cancer, alcoholism, we're talking about drug abuse, and teen pregnancies, okay? Repeated stresses sort of set the trajectory for a person in their health in terms of being an adult. Now, when we talk about looking at neighborhood poverty, we see this. And so the darker areas in here are areas that have more than 30% of the families living in poverty. And when we look at births, that means that for us, 1 in 3 children are born in poverty. And that's roughly about 2,000, a little over 2,000 births a year. Now, on this next slide, we look at life expectancy. Now, you may notice that some of the colors are about the same in terms of the areas of poverty. So poverty does have an impact in terms of life expectancy. And what's interesting about this slide, in terms of the darker areas, so less than 77 years of life, and this is from birth, okay, without any other factors. We showed this slide just to one youth in our department, and they looked at this and said, I don't know anybody that's reached 77 years old. Which is kind of shocking, because we're looking at this data going, okay, 77 looks like about that, but many people don't know or see anybody living that long, especially when they're young. So what do you think that they think about in terms of living? They don't even see that goal. They don't even see anybody reaching that. Just in terms of looking at it in a bar way, 7-year difference if we're talking about our most affluent areas and then our most impoverished areas. This is actually an interesting slide. I could spend all day on this slide, but the point of this slide is in general, there's a social gradient when we're talking about health. So as income declines, so does life expectancy. Usually pretty consistent. There are a couple of outliers here in terms of looking at Latino and Asian populations. And we're still trying to dig in this a little bit. Some of this we think is related to social factors in terms of the relationship that the community has amongst itself. Other is the fact that if you were talking about those who are foreign-born and those who are born here and the same race, ethnicity, those that are foreign-born actually have better life expectancy. So the longer that you're here, the context that you find yourself in here in the United States, the lands of opportunity, your health declines, okay? So there's a context in terms of people and their life expectancy. If we take an example looking at Oakland in and of itself, so a white child born in Oakland Hills, African-American child born in East Oakland, and we're talking about, what, a few miles? Looking at the trajectory, so 2 times more likely to be born in poverty as an infant or low birth weight. 12 times less likely to have a mother with a college degree. If we look at childhood, 21 times more likely to live in poverty, 3 times less likely to read at grade level. Reading at grade level, education, sets a trajectory for jobs, etc. Going into adulthood, in the same area, 6 times more likely to be unemployed, 2.5 times more likely to die of a stroke, a preventable condition. So if we add these different things up over the course of a lifetime, we can see a 15-year difference in life expectancy, okay? Additive effect. Now, when we talk about poverty, we have to consider not just simply that people don't have money, but that there are conditions that are unequal in terms of this. And so when we talk about outcomes, if we look at neighborhood poverty and health outcomes, notice our most affluent area, notice even our poverty area, and in terms of the 10%, 20%, and then the 20 and 30%. There are some differences here, but notice in terms of the affluent, in the top 5 causes of death, Alzheimer's. That drops off when you start to look at poverty. You get into unintentional injuries. But then notice here, in our most impoverished areas, what jumps high? Homicide. So we have to think about the context and the perspective in terms of the different levels in different areas. Now, if we're talking about youth, it drastically changes. The top 2 leading causes of death, homicide and unintentional injuries. So I can't always take all data in terms of all populations. I have to dig a little bit deeper, and we always have to do that to really understand where do we need to focus. Now, when we talk about impoverished areas, we have to think about conditions. Now, I want you to look up here and tell me which of these things is generally in an individual's control. I can wait. Okay, all right, so we kind of got that. I mean, maybe income and employment, possibly, a little bit. But in general, if we're talking about crime and safety, not necessarily in an individual's control. If we're talking about the quality of affordable housing, it's not in an individual's control. If we're talking about how land is used, it's not in an individual's control. Education, the quality of schools, not in individual's control. And so as we talk about what we see in terms of these high poverty areas, in terms of low life expectancy, when we see these conditions consistently in those areas, we often see poor health status. Now, I'm going to go through these very quickly. I'm not going to go into all the details. So as a result, looking at those same factors that are not in an individual's control, this is what we start to see. 2 times less likely to have access to stable and good employment. Struggling with half of what others generally make. So a person living on $50,000 versus a person living on $110,000. Looking at the number of absences from school. Now, we're sort of digging into this a little bit. We're trying to figure out if these absences are just because kids aren't going or if there's some health issues there. And if we can figure out their health issues that we can help on, we'll try to deal with that. 4 times less likely to have less than a high school degree. 4 times more likely to be living in overcrowded households, and 2 times less likely to be severely burdened by, or 2 times as likely to be severely burdened by rental housing costs. The poorer you are, the housing costs are really important. The disposable income that you have to pay for transportation, to pay for food, to pay for medicine is really important. Homicide, I hate showing this slide, but it's one of the facts that's there. 8 times higher rates of homicide when we're talking about impoverished areas. Now, this is the context in which we're talking about families and children living and growing up. Also, 5 times more likely to be locked up as a youth, overwhelmingly for nonviolent crimes. And I've actually watched this as a kid. Looking at the burden of the land use in terms of, we find a high density of industrial and chemical fuel release sites, so the air pollution, air quality is generally worse. 7 times more likely to live in households with 0 vehicles, meaning you're public transit dependent. So how much do we focus in on public transportation in impoverished areas, knowing that people need that public transportation to get to what they need, whether it's a job, whether it's healthcare, or whether it's groceries. So what we're trying to do is say, look, there's a context in which people find themselves, and there's something that individually they cannot change. It's not necessarily their individual choice. There's something that all of us from our perspective have to do. And so we want to change neighborhoods to have those things that are supportive of people, whether they're impoverished or not, that support them to be on a trajectory for good health and opportunities to live a healthy and fulfilled life. So when we talk about investing in both people and places, oftentimes a lot of the discussion you hear on is about the individual. Now, there is some truth to that, but the individuals make decisions within a context of what's around them. And so our job is to not just think about the individual, but to think about what are they living in. If this is the context, what does this say to our children as they're growing up? Versus, what does this say to our children and our families as they're growing up? So we're trying to change what we talk about in terms of landscape, not just thinking about the individual, but thinking about landscape, the context in which they find themselves. For our vision in terms of Alameda County, we really want to say that everyone in Alameda County, no matter who you are, whether you're disabled, gay, lesbian, how much money you make, where you live, or the color of your skin, has an opportunity to lead a full, healthy, and productive life. All of our department, within our department, we have a number of different programs. We try to put out as much information as possible. Understand that if we're knocking on your door as the health department, it's because there's a context. There's some importance that you have in terms of your organization, in terms of the actions you take to improve what we're seeing in terms of health. And so we'll hope you join us in that war. In this, we're actually all in this together. Everybody from your perspective, from your position, wherever you are, has an opportunity to impact what we see. And we hope that you'll continue fighting this war. Thank you.
Thank you, Dr. Davis. That was, I want to say it was a really great presentation, but it was really sad, but a great presentation. And it's one of those things where you wish you could say, oh, I'm shocked, but I'm not. You know, we continue to kind of to see these statistics, and it tells us that there's a lot of work to be done, and hopefully it energizes us to think positively about what we can do. But great presentation. Now we are going to be joined by Sarah Bone, Dr. Sarah Bone. And Dr. Bone is a research fellow at the Public Policy Institute of California. A labor economist, Dr. Bone's work focuses on how low income and vulnerable on how policy impacts individual and family economic well-being, with particular attention to low income and vulnerable populations. She's published research on poverty, underground labor markets, the future of California's economy, California's community colleges, and the labor market impact of immigration policy. She's also conducted research on income inequality during the Great Recession, with a focus on the role of unemployment and educational attainment on family economic outcomes. Dr. Bone holds a PhD in economics from the University of Maryland, College Park. And I'd like to invite Dr. Bone up to present new data using the California Poverty Measure on outcomes in Alameda County. And after her presentation, we'll be taking questions from the audience.
Thank you. It's really a pleasure to be here to talk about our research at PPIC. And I really appreciate the invitation from Andrea to participate. Just by way of introduction, for those of you not familiar with PPIC, we're an independent, nonpartisan research institute that's focused on major policy issues in the state. And one area of great concern, I think, to those of us in this room and to me as a policy researcher is the high rate of poverty in California. It's really striking how much economic need in and of itself, among all the other factors that impact families, is really related to a host of adverse outcomes. Health and the others that Dr. Davis summarized, it's just really striking how money alone matters. So we do have a large set of government safety net programs that are aimed at affecting that, and we're wondering about how effective they are. With those questions and concerns in mind, we at PPIC are working on research to create more accurate measures of poverty and need in California and across the state. And we're also thinking about this research as a tool for informing and improving our programs in California. So I'll talk about our latest research on that today, the California Poverty Measure. This is joint work with my colleague Caroline Danielson, who's also here today, as well as researchers at the Stanford Center on Poverty and Inequality. And the goal of our research was to give a more accurate, big picture view of poverty in California. Okay, let's see if I can figure out. All right. This is just a long-term picture of what official poverty rates look like in California. The top line, the grayish one, is for children, and the orange line below is for all people in the state. You can see that the most recent data, which pertains to the year 2012, suggests that poverty in California was quite high on historical standards, although had begun to turn around since the first turnaround, in fact, since the Great Recession started. In Alameda County, I threw in these couple dots just to show how it kind of compares to the statewide picture. So as of 2012, about 16% of Alameda's children were considered poor on official measures, and about 13% overall. However, what we measure matters, and these official statistics, although I just showed you a slide on them, are lacking in many ways. The official poverty formula was developed in the 1960s and has been useful for tracking trends, like that previous slide, and also is used, of course, to determine eligibility for many safety net programs. But it has not really been modified since the 1960s, despite what we know about how families' needs have changed, especially the changes kind of in what we spend money on, the cost of living, like housing costs, childcare costs, medical out-of-pocket expenses, all things that have changed substantially since the measure was developed. The official poverty measure, also does not account for many of the large-scale anti-poverty programs that are part of the War on Poverty efforts that Supervisor Chan was discussing. So, for example, it does not reflect the impact of the Earned Income Tax Credit, which is a major player in anti-poverty programs in the U.S., or CalFresh food stamp programs. So in that sense, we can't really look to the official poverty measure to tell us how we're doing in terms of that war on poverty. So with that shortcoming in mind, researchers and government agencies have really been working on alternatives to, and this kind of began in the 1990s and culminated in 2011 with Census Bureau's Research Supplemental Poverty Measure. It was released for the U.S. in 2011, and it is kind of an ongoing research effort to define alternative measures of poverty that can shed a lot of light on these questions that we have. And it's that kind of research effort that we at PPIC and Stanford Center on Poverty and Inequality have joined in. And in October of last year, we released a report on our measure, which is called the California Poverty Measure. The title is slightly different, but we are using the same methodology. We've just adapted it a bit to make it, we think, a bit more accurate for California, as well as to provide the wealth of detail that we really need in the state. And just in a nutshell, kind of the major changes that we make in our poverty measure compared to official statistics are in three kind of realms. First, we take a bigger picture view of what families have in terms of resources. So not just what they make from earnings, but also resources that they have from in-kind programs like housing subsidies and food stamps in California, CalFresh, as well as tax-based safety net programs. So the EITC is not reflected in official statistics at all, and we account for those additional dollars that many families have at their disposal to make ends meet. And the second kind of major change that we make is to think about some expenses that families face, out-of-pocket medical expenses and work expenses, thinking about childcare costs and commuting costs. Those are big categories of expenses that are unavoidable for many families and eat away at their resources that they have at their disposal. And then the last is we take a different kind of threshold of need. So it's a basic standard of living, just what it takes to maintain a very basic standard of living in categories of clothing, food, shelter, and utilities. But we allow that to vary depending on where you live, which is kind of a common sense thing, but is not what's done in the official poverty threshold. So for most people in California, our kind of poverty line is about $10,000 more than it is for official measure, so around $30,000 for a family of four. And I'll talk a little bit more about some of those regional differences and what it is in Alameda in just a few minutes. But I wanted to show you kind of the big picture result that we find. So overall in the state, this arguably better, more comprehensive measure of poverty, the California Poverty Measure, suggests that about 22% of Californians were poor in 2011, which is the year of our study, or 25% of children. So a significant jump over what we thought we knew about the number of people poor in the state from official poverty statistics. One, I guess, slight piece of good news, I'd say, is we find that fewer families in the state, and fewer children in particular, are in deep poverty situations, meaning that they're in a family that has less than 50% of what they need to make ends meet. So for children, that actually was cut nearly in half. And I wanted to show you what we found in Alameda. We see that kind of the general overall story is the same here as it is for the state overall. Under this better measure of poverty, we find more residents in Alameda are poor than you would expect based on official statistics. So about 18% of residents, or nearly 22% of children. So what that kind of amounts to in terms of number of people is, I think, somewhat striking. So overall, we find about 280,000 people in Alameda are considered below our poverty threshold. That's an additional about 80,000 or so, but that's a 40% increase over that kind of 200,000 number that Supervisor Chan was mentioning earlier. For children, it's about 75,000 children, a significant jump. In Alameda County, we find that less than 5% of children are actually in families in deep poverty. Similar kind of to the overall story. When we think about how the situation here compares to other regions of the state, you'll see in these first few bars that Alameda looks kind of similar to the San Francisco Bay Area, the 9-county region overall. In San Francisco, poverty rates under our measure, both for people overall as well as children, are significantly higher than it is in Alameda County. And then we look a little bit more broadly across the state, including Los Angeles, which actually under our measure has the highest rate of poverty of anywhere in California. Alameda looks relatively better. Thinking about the Central Valley, we see if you look kind of across the chart, the rates of poverty in the Central Valley region are roughly similar to what it is in Alameda, which I think is pretty striking given what we thought we knew about where pockets of poverty are located in California from official statistics. And those areas tend to be clustered in the Central Valley. So this new measure, taking account of real expenses and costs faced by families, really kind of flips the picture of regional poverty in the state. And I'll start to hint at why that is. So these are what we estimate as the the poverty threshold. So for a family to be considered not in poverty under the California Poverty Measure in Alameda, for a family of four, they would need to have resources totaling over $32,000. The orange line indicates what the federal poverty line for the same period was. So in 2011, it was about $22,800. So about $10,000 more dollars. It's higher in all those major regions that I showed you earlier. Except in Fresno is where we see this kind of smallest jump in terms of the threshold needed to make ends meet. And this hints at what is really driving the kind of this new story about poverty and the higher rate of poverty in California compared to the rest of the US, and higher rates in some regions rather than others. It's largely a story of cost of living. It's not really surprising when we think about how much a house costs here in California. There's only a few counties in the state where median housing prices are even similar to what it is in the US overall. Fresno is one of them that's pretty close, and so that's why we see a smaller jump there and lower poverty rates overall. But it's not what we find, and this is kind of the striking results that I wanted to get to next, is that this is really just half of the story. So when we think about how families actually are making ends meet, they are facing higher housing costs, and that tends to drive up poverty. Medical out-of-pocket expenses, childcare costs also tend to drive it up, especially for certain groups of Californians. But this is really just part of the story. Safety net programs in California benefit millions of people. We spend billions of dollars, in fact, at the federal, state, and local level on our major safety net programs, needs-based ones. And this chart just kind of lists some of the major programs that we looked at in this first round of research. Of course, there are other safety net programs that matter a lot for families, and we would love to look at those further in additional research. But what we've looked at are benefits that families receive from the CalWORKS program, general assistance, supplemental security income, CalFresh, food stamp benefits, child tax credits, earned income tax credits, housing subsidies, and school meal programs. And what we find is, I think, quite striking. So these are our overall poverty rates in California. If we were to exclude the resources that families have from these safety net programs, poverty rates would be substantially higher in California. An additional 8% of people would be considered poor, an additional 14% nearly of children. So nearly 40% of the state's children would be considered poor were it not for these need-based safety net programs included. The same is generally true in Alameda, although you'll note that the effects look a little bit smaller. So an additional about 5.7% overall would be considered poor in Alameda, an additional nearly 9% of children would be counted as poor without those major safety net programs. So that's an additional about 30,000 children considered poor without the safety net resources, or an additional about 87,000 people overall. I think from this picture, it's clear that the safety net plays a really big role in meeting family needs both in California and Alameda, and especially for children. The effect, though, as I noted, is here's the overall state picture, a little bit lower in Alameda County. And why is that? I think we've begun to dig into this a bit more, and it's clear that earnings play a larger role in the Bay Area and Alameda County compared to the statewide overall. So in families that fall below our poverty threshold, about 73% of them have income from working. As much as 83% of people in families with children below the poverty line are working as well. And that's a little bit higher than in some other parts of the state, like the Central Valley and San Diego in particular. So it may be related to job opportunities and economic factors across the state and other regional things that are driving opportunities and differential opportunities across the state. And more research is really needed to pin that down. But we also think about how the safety net is reaching people and how that varies across the state. Alameda County ranks 31st out of 58 counties in terms of its kind of utilization or access to CalFresh. If you're familiar with the California Food Policy Advocates measures of access by county. And Supervisor Chan was mentioning this as one of the areas of focus of improving the reach of CalFresh in Alameda County. And it does beg the question of how much larger these poverty-reducing effects of safety net might be were we to really improve that take-up rate of the program. If more people who were actually eligible for these large-scale safety net programs were actually making use of them. And more research does need to be done in order to kind of pin that down from a big picture policy perspective. And I wanted to close by just mentioning that these are some snapshots that we think provide a better picture, a more accurate estimate of how many people are actually falling below or failing to meet their basic needs in Alameda and in California. And I think it's really clear that the safety net is playing a very large role. We want to know more than just these snapshots, though. We want to think about how interaction with these safety net programs impacts a child or a family's ability to get out of poverty or to stay out of poverty over the long time. But we start with having this, we hope, more accurate picture of need, and that's what the California Poverty Measure was designed to provide. There are additional resources on our website at the bottom of the page where you can kind of break out some of the safety net programs individually and get a little more regional detail. And we are happy to talk with you further about how this research might be used in your day-to-day work and how we might support improving policy decisions on these important issues. Thank you.
Hi. So first of all, I really wanted to thank Dr. Davis and Dr. Vaughn, especially for their presentation. I think that they were both very, very enlightening, and they put into perspective a lot of different things that come together to impact children and poverty as a whole. So thank you guys a lot. As someone who's sort of coming of age right now and having to deal with moving out of poverty in a lot of ways, and also sort of developing my own income, figuring out how much I should be spending on rent, as well as seeing a lot of people that I grew up with struggling with the same issues. I came up with a lot of random squiggly notes all over. I have a diagram. So I'm gonna try and make this as succinct as possible. But I did want to ask a question. While we're talking about safety net programs and we're talking about how many people who are eligible for these programs not actually accessing them, and there being difficulties there, I also wanted to make a point. As Dr. Davis said, a lot of the things that were listed in his presentation about violence and incarceration, among other things, are not necessarily in the control of individuals, especially when people are living below the poverty line or growing up as children in impoverished homes. So I feel like as long as we are making our safety net programs not accessible to people with certain levels of convictions, how much are we adding to the level of poverty and the level of people who are unable to access safety net programs and therefore impacting their children? So I think that's my question.
I appreciate that and your perspective in terms of developing and sort of thinking about these issues. I think the safety net is often there to sort of get over a hump. And unfortunately, the need that's out there for some of what we see, there's just not the funding to be able to meet all of the needs. Which means that in this, there has to be sort of a multi-level and multi-sector approach to it. It's not simply the safety net, but it's also the question of how do we set people up. When I think about education as one thing, when I was growing up, there were after-school programs. How many folks know of after-school programs in public education at the moment? Okay, they're few, but it's not everybody in the room sort of raising their hands. So what we have sort of pulled away, I think, are some of the things that keep people engaged in other stuff, especially for youth. So it's not simply the safety net. The safety net in terms of food and income is helpful in terms of helping with housing as well. But also, what are we doing that sort of support and set people up to be successful in work, even in the skills that they learn in school, to help them sort of get that next level of employment, that next level of activity within society. Hopefully that answers your question. If it doesn't, tell me it didn't.
Okay.
Okay.
So we're going to take a few more questions. We're running a little bit behind, so I know we don't want to take too long with them. But if anyone wants to come up and ask, you can walk up to either the mic on this side or over there.
Good morning. Thank you for all this insightful work and all the work that you're doing. And my question is, watching, I'm a little older, so I watched, the attack on families in San Francisco, watched them flee and come to the East Bay and Sacramento and all that, and all the families that were already here and then all the new families who came. Now I'm watching them all flee as a result of the massive distribution of drugs and guns in in all of the neighborhoods that are full of people of color, especially full of children. And I'm a social worker, so I try to stay relevant and try to stay updated on what's going on overall to improve the quality of life for people, especially children. But also, I work from a solution place. Like, how can I equip a mom and a dad that I know is going home to a war zone that hasn't even been declared a war, so they don't even have the luxury of declaring how tragically impacted all these things are. And I don't often hear this big elephant we have in the living room that's affecting and impacting all of our lives, but especially the lives of children in such a major way. And I don't often hear policies or programs or strategies to, like, I would love if we could do like we did in '64 when we went to, the National Mall, to show up at the National Mall and say, look, we can't take no more dope. We can't take no more dope, and we can't take no more guns, and that's it. And yet, even when I make these statements in big public venues like this, I kind of feel everybody kind of tense up, because what can we do? What do we do? We can tell the truth, but the reality is, while we're here right now, there's some children being gunned down right this minute, and there's some parents being gunned down right this minute, and there's some incarceration going on right this minute, and none of us really know what to do. So any work or any ideas to get us out of this big mess we're in right now? Any more work we can do?
Yeah, so
I'm gonna sit down.
Sure. When you said elephants in the room, I could think of a number of them, to be honest with you. One of the things that we see, even for our staff who are visiting folks in their homes, they're running into things that they're just not equipped to deal with, whether it be domestic violence or whether it be someone who's seen some violence. Some of our staff who are here have been around when gunshots have gone off. And so as a department, we're sort of thinking about what can we do to sort of help either limit the impact of that in terms of talking with them about that, or get them connected to someplace that can. And a lot of this is really around a capacity issue, and I'm not saying that that's an excuse, but it's a truth. But we're trying to figure out, how do we sort of connect with others and not take on the full set of responsibility, but understand that if we recognize it, if we see it, how do we sort of connect, and who do we sort of connect with, and what skills can we sort of teach our staff to sort of be able to deal with that. But in some of this, it's like the movies. I remember, a long time ago, we didn't see a lot of violence, right? And now we see tons of it. And so much so to the point that we're a little bit apathetic around, it's just violence in it's just in the movie. And so some of this, I think, because it's gone on for so long, there is some bit of apathy and a bit of belief that we can't do anything about it, when actually I think we can. But I think if we're looking at supporting families, we have to look at that, again, at that context that they find themselves in. What is it around education? If you have families moving in, I'll take Oakland as an example, to Oakland, and most of those who can say, I'm not sending my kid to the public school, I'm sending it to the private school. The more kids that aren't in the Oakland public school system, the less funding they get. So it sort of compounds the issue of the ability of that school to sort of do what it needs to do. And so we have to think about, what is it that we have to do so that when somebody plops down somewhere, that they have all of the things that are needed in order to be healthy and live well. And that's where we have to focus in on the context in which people find themselves. And that is really the key, I think, in that. There's no one magic bullet that's going to solve all of this, and it's going to take time. We can't sort of put in a program and say within a year or two we're going to solve it all. There may be some things that we do have in terms of successes, but it's going to take a little bit of time, and we have to be able to stay in that fight in order to do it.
Does anyone else have any more questions? Go ahead.
I have a question for Dr. Davis. I started working about 6 months ago for the Department of Behavioral Health Care Services. And one of the things I've learned about Alameda County that I've seen as a strength is just the incredible number of different cultures that live in this county. It's so diverse. And then listening to your presentation, which I always appreciate hearing about the Place Matters work that's going on at the Public Health Department. You mentioned that there is a stressor involved in being a first-generation immigrant, and then that kind of the stress level goes up the longer you're here. And I was wondering if you could elaborate on that.
Well, well, some of it may be stress depending on what it is, but it's actually just being here, period. And so it's not, I can't say it's always stress, but what's in the environment that's different? Is it the food? Is it the ability to pay for certain things? Is it the ability to find a job, et cetera? So we have to dig a little bit more in that, but it's not simply the stress. There has to be some other context in addition to that that's sort of there. Because even in stress, I mean, when we think about those who survive in stress, there are things that they have that help them to cope and deal with it. And so the question is it just simply that, or is it that once they get here, the type of food, the type of environment, the air quality, et cetera, is just worse than where they came from? And so we have to dig a little bit more in that. So I don't have the complete answer for that, but that's just some of the thoughts that I had around that.
Okay, thank you.
So we actually have to cut off our questions right now, but thank you so much for your answers, and thank you so much for your questions. We'll have another question session after a few more sections, but we're actually going to take a 10-minute break, so I guess we'll be back at approximately 10:40. Walk around, have beverages.